Hello, good afternoon. My name is Cindy Yell, and I'm President and CEO of the Toronto Rehab Foundation. And welcome to our Blakely Health Innovation webinar, live webinar broadcast to you. We're beaming to you from Discovery District. We are in the heart of research and science and innovation, not only in Toronto, but in fact, right across the country, and one of the highest concentrations, as I understand it, in the world. And so it's our privilege to be sharing some really important information with you today. So as many of you know, you've signed on before and joined us on these live sessions. We do them probably about once a month now, and we do them in our auditorium at Toronto Rehab, but we also like to beam them out to you. And in fact, we have people from all over the world today with us. We have individuals signed on from Calgary, from Moncton, Florida. We have some folks from the UK and from Montreal as well, and many, many people from Toronto and Ontario. So thank you for joining us this afternoon. I should always, let you know that these seminars and these sessions that we do really are made possible thanks to some very generous sponsors and donors of Toronto Rehab. Certainly, Bob Blakely was the brainchild behind this seminar series that we host and supported it pretty dramatically in the early days. But we have many sponsors as well today. And so we have, I believe it's Ninestein, we have FAF, we have Functionability as just a few of the sponsors, and I think you'll probably see them up on screen as we go through the session. Today, like I said, is a very special session that we're hosting. We have Dr. Paul O, and Paul is really a rock star at Toronto Rehab, and in fact, right across the health system. Paul is the director of our cardiac rehabilitation and secondary prevention program at Toronto Rehab, and also is the holder of the Good Life Chair in Cardiac Rehab. Today's session is entitled THRiVE, and it's 12 steps. It's a 12-step program. 12 steps, a different type of 12-step program. 12 steps to better health. And so really what we hope is that we'll be able to give you some tips and some strategies to make little shifts in your life that will help you live fully, help you kind of share this information with your loved ones, your family, your friends, and your colleagues. And really what we're all about is maximizing life, really giving you the tools to go out there and make a great go of it. So I also wanted to acknowledge some of the corporate sign-ons that we have today. We have staff, employees, and senior leadership from organizations including BMO, Medavie Blue Cross, Sun Life, Old Republic, TD, RBC, Scotiabank, and Longo. So big shout out to all of you for joining us today. Really appreciate your support. So on that note, I'm going to be quiet. I'm going to pass to Paulo, but before I do, I want to let you know that this is live, and one of the real benefits of this session is that we open up to questions at the end of the session. So in about 30 minutes, we're going to be asking you to share your questions with us, and we'll have Paul O, Dr. O is our resident expert, medical expert, to answer them. So don't be shy, send in your questions. I believe the email address to send them to is trf@uhn.ca. So again, it's trf@uhn.ca. Don't be shy, send them in. All right, Paul, to you.
Terrific. Well, thank you very much, Cindy, for leading off this session again. It is indeed a pleasure and a privilege to be with you, to share in a topic that's near and dear our hearts. So welcome to our friends in the room, locally in Toronto and indeed around the world. The topic for today will be around a program that we call THRiVE, Targeted Health Risk Interventions and Education, and trying to simplify an approach to how we can actually help you take meaningful steps towards being healthier. As Cindy mentioned, we have a number of sponsors specifically for this session in particular, and we're very grateful for their ongoing support to make these sessions possible. As Cindy mentioned, we do welcome questions, so if you'll jot them down through the course of the next half hour or so and share them with us at the email address, we'll put this back up at the end of the session just in case you need a prompt. 12 steps to better health. The outline for the next 30 minutes or so, let's touch a little bit about topics that are near and dear to us in healthcare, to your workplaces, to home. The burden and challenge of chronic disease. We'll define what those are and why they are so important for our health system. And then lead into the central role of health behaviors as something that can actually modify and address this burden and challenge. We'll break this down into 12 steps that you can take to address these chronic diseases, and steps that we can make in terms of our own health. And this will be an invitation then to thrive, a meaningful dual play on the word. When we talk about non-communicable diseases or chronic diseases, it's a term that's used in health circles everywhere. And in Canada, these are the common kinds of conditions that we talk about, conditions that affect our heart, or diabetes, or cancers, or conditions of the lung, mental health issues, or arthritic conditions. Why are these so important? Because they are common throughout our society and in our healthcare system. We are standing right now in the basement of Toronto General Hospital. Many of the individuals who are currently being managed in this hospital or the emergency department are entering because of conditions that might be represented to one of these, or a complication of one of these chronic conditions. If we look across lifespan, if we focus on the middle-aged to older population who is living in Canada, the Public Health Agency of Canada produced these statistics that would suggest that as we age, we actually accumulate one or more of these conditions. And by the time we hit our senior years, in fact, everyone has something, and most people have more than one of something. And on average, about 70% of Canadians will be living with one of these chronic diseases. So in fact, it's the norm, not the exception. If we can learn how to better manage ourselves when we live with one of these conditions, or even better, if we can actually prevent them in the first place, we may have found one of the secrets to better health for our society. This is important economically as well, because 2/3 of all direct healthcare costs actually relate to management of these chronic conditions. About $190 billion annually is spent on the management of these conditions. $68 billion is on the medical side in all of our hospitals and our clinics and family practices. But twice that amount is actually seen in our workplaces in terms of lost productivity, disability, absenteeism, lower presenteeism as well. So these are important issues for us to tackle from an economic perspective when we think about chronic disease. So if we stylize this in a figurative way and think about the tree, and this is not such a nice tree actually, this is a tree of chronic disease, and at the branches would be those chronic conditions like diabetes, heart disease, cancer, and lung disease, and think about what feeds the growth of this tree in terms of the roots. And here we get into this concept that actually chronic disease, whatever it is, actually has a chronic or a common place. And that common health behaviors like smoking, not eating well, drinking too much, and not being active enough, all of these are common elements that lead to the development of all of these chronic diseases, which then leads us to think, well, if we can focus on these health behaviors, rather than focusing on disease management per se, this is the way we're going to change the curve. Traditionally, our healthcare system has been focused at the tops of the tree. How can we lop off or prune the branches, try to tweak, manage, medicate, do procedures once conditions are established? Instead, the revolution in healthcare could be at focusing on health behaviors. And by the way, 80% of Canadians have at least one of these risks. So that led to us thinking that for all the programs that we offer for people living with heart disease or stroke or cancer or diabetes, we can think about the interventions that we offer and the education that we offer in those programs and bring them together in a common platform that we've labeled with the acronym called THRiVE, which sounds like a great type of program that you want to sign up for. So this is an invitation to thrive. Let's walk through what we have offered here. And this is part of our, I guess, our gift to you. We have been working for the last number of years through strong collaboration and support of the foundation and our corporate partners out there and our patient partners to build a program and platform that we call the Health E-University. And within the Health Electronic University, we have a series of colleges: Cardiac College, Diabetes College, and within the colleges we have a whole range of wonderful offerings, including this program called THRiVE that is available to all of you. No charge. We just want you to do it and enjoy and embrace it. So if you go to the Health University website, you'll find a link and a tab to come to THRiVE, Small Changes for Better Health. And within THRiVE then, what we have described is 12 tiles that are color-coded that represent a 12-week journey for each of us. It'll start with creating an action plan for change, doing a series of exercise or physical activity modules, healthy eating modules, a call out to taking medications appropriately, managing mental health and relationships, depression, stress, burnout, sleeping well, having great relationships. And if we can do all of these things together, ultimately we lead to a place where we are in control of our own destinies, our own health, and we can make a choice of health every single day. We're going to go through this in a little bit more detail over the next 20 minutes or so, but I hope you'll find that this is actually compelling, it's thoughtful, and it's progressive in nature, and you can choose your own journey through this. The anchor points are choose your journey, achieve it at the end of being in a better state of health, but you can choose your own steps in between. It is also available aussi en français for our francophone audience, that this is completely bilingual in nature, as is our Cardiac College web platform, so available for all Canadians. So, creating a plan to thrive. Where should we start? And deliberately we're calling out creating a plan for change. I'm going to go through this one in a little bit more detail because it sets up the framework that will be familiar for each of the other 11 modules. And within Create a Plan for Change, you'll see that how do we actually arrive at a destination, whether it's business or health or something at home, we'd ask you to define 3 simple steps. What is your vision? Where do you want to go for this? Set a simple, smart, actionable goal, and then build an action plan. And if we can do these fundamental steps, whatever we're trying to do, whether it's getting more active, eating better, stopping smoking, moderating alcohol intake, that these are the ways that we're going to get there, and be thoughtful and logical and deliberate about that process. When you come into any one of these modules, you'll see that there is a 4-step kind of framework for every one of our THRiVE modules. Learn, plan, do something, and then reflect on it. And a week of time is actually a lovely, convenient time frame to actually be successful with this. Within the goal-setting action planning module, learning will be about how to create a plan for change. In each of these modules, what you'll actually see is a lovely video that's smartly animated, creatively put together with the right kind of content that's very, very friendly for adult learning. And indeed, this is actually an award-winning video series that was kind of recognized at Media Awards for Health. So look at these things. There's about a 3-minute video on creating a plan for change. We're not going to do that together right now, but I invite you to go to the web platform and see the one on plan for change, or for exercise, or for healthy eating, or for better sleep. They're all there for you. But the week would start with learning about the activity for the week. Then we'll invite you to actually plan out what you are going to do now that you've learned about something. For instance, around goal setting and action planning, let's plan out what our tangible next steps are. Not just watch a video and then walk away with it, but let's actually do something with it. So if the idea is that we'd love you to learn about how to make a plan for a new healthy habit, then there are some thoughtful steps that we should go through to actually help you on that journey. You're more likely to make a successful change if you can think about importance and readiness and confidence. So that's the planning part. Now, actually doing something is, once you've set up your plan, let's actually take some steps in that week to achieve success on this marker. And then once you've done it, we're going to ask you to reflect on how you've actually done for this week, what went really well, what were some struggles or challenges, and then set you up for what's going to happen next week. And you're going to see that week by week, we're going to build confidence, we'll build efficacy, we'll build self-control as we move through all of this, so that the structure of learn, plan, do, reflect is really, really important. Give you some more examples of what's actually going to happen when we goal set an action plan. Let's take you through this, for example. Start your plan. What change do you really want to make? And this is completely self-directed. Is it something about getting more active or eating well, about taking medications or having better relationships? Or is it a topic around relating to stress or anxiety or depression or burnout? I think we can all relate to one of these sorts of topics and set that up as your goal. What the platform will help guide you through is actually, here's a step, and you can interact with the platform and enter this on the web, on your phone, whatever's convenient to you. So we're going to ask you, what healthy habit do you want to start doing in this week? And let me put in, for instance, for myself. I have had a little bit of a love-hate relationship with running over the last few years. I've done my 11th half marathon. Number 12 is coming up, and we're going to continue on and do other great runs with the foundation through the course of this spring. So I go through these cycles of where I need to get more active. Get active will be my healthy habit that I want to achieve. The platform asks you now, how important is this to us? And there's actually really good signs to say that this is a good question to ask. On a 0 to 10 scale, where 0 is not important and 10 is really important, I'm going to rate this as an 8. On the other hand, if I said this is a 2, this isn't very important to me, then maybe I should rethink if this is the right goal to be working on. If something's not important, chances are I'm not going to do this. And if I actually don't score a 7 out of 10 on this one, then maybe I can rethink, reprioritize. Maybe there's something else that I want to do. All right? This is important, for instance, when we talk to clients who are smokers, for instance, committed smokers, hardcore smokers. And everyone knows that probably smoking is not the best thing for our health. But if it's not important to us to quit today, then maybe there's something else that we should work on. Don't lose it, park it, come back to it, but let's talk about what we need to get to a 7 on that basis. So what healthy habit am I going to work on is getting active. And then the next question past importance is readiness. Once again, if I'm not at a 7 out of 10 to start working on this, maybe I should rethink, reframe, and make another decision. But in this case, I'm ready. I've got my shoes, I've got my time set out, I've got my headband, I've got my t-shirt, I've got the shirt, I better do something. So here I am, a 9 out of 10, I'm ready to get active. And then let's make a smart kind of plan. And we know about these things that are measurable and actionable and timely. So we're going to ask you the questions. So if you want to get active, when exactly are you going to be active this week? So today is a rest day, but actually Wednesdays are hill days, so Wednesdays are actually fun. But Tuesday, Thursday, Saturday will be 3 runs this week. I'll do it on the indoor track at our program and an outdoor trail on the weekend. I'll do 5 kilometers, 10 kilometers, 14 kilometers, because Sunday's the long day. That's so much fun. And I'll do this 3 times per week. So you can see that there's actually a real commitment and a plan to doing something like this. And so for whatever behavior we want to choose, setting it out in this way is going to be a recipe to be successful. We do this day in, day out. We have a fantastic team at our program, and they work with every individual about setting these plans. And you set up one plan, be successful, and then you work on your next plan. And this is the way to keep it going. So in the end, I come up with, here's my action plan for the week. Get active Tuesday, Thursday, Sunday, indoor track, outdoor trails, some distances and times. And then finally, we can ask you a question about confidence. How confident are you going to be able to do this? And if we need some help with building confidence, then maybe it's actually looking at some elements that are there on the weekly action plan. If I can't do it 3 times, if I'm not confident I could do this 3 times, maybe I can do it twice or once if I'm not confident about the time or the distance. Maybe those things should be scaled back, and that's what the confidence question will ask me. And if I've got 7 out of 10, that's great, I can move forward. So that's an example of a single module, single week. Learn, plan, do, reflect, see the video, do the work, come up with your action plan, carry on. Sound exciting? I hope you're excited. So that was that was week number 1 where we set this up for you. And then we're going to go through weeks 2 to 11, kind of in quick format, but just giving you some tips, tools, teasers, tidbits. Wow, that's a lot of teas. So suppose you chose as your next adventure, I would like to start an aerobic exercise program, walking, jogging, cycling, swimming, something that gets your heart rate up, gets you a little short of breath, a little bit sweaty. One of our colleagues, Dr. Bob Salas, who's the chair of the Exercises Medicine Movement internationally, says there is no better indicator of a person's health and likely longevity than the minutes per week of activity that he or she engages in. This is probably the best fitness marker of all, or the best health indicator of all. If I only knew one thing about you, not your blood pressure, not your cholesterol, not your family history, but simply how active are you in the course of a week, then I'd have a pretty good idea what's going to happen to you over the next 5 years. So getting exercising is really, really important. What's the challenge? Well, we know for Canadians that there is some opportunity. And Stats Canada, through surveys, will occasionally look at the health of Canadians. And if we ask Canadians how much do they do, well, we can ask them in different ways. For instance, we can ask a bunch of Canadian adults, do you take at least 10,000 steps per day? And about a third of Canadians will actually do that. I think we're all aware, though, that the actual guideline for health is that we try to achieve 150 minutes of moderate to vigorous physical activity per week. So not just steps, but steps with some purpose. And now we're down to about 15% of Canadians that actually reach that threshold. What if we ask Canadians now to do 150 minutes of moderate to vigorous physical activity, but in sessions of at least 10 minutes on at least 5 out of 7 days? So there was some thinking in the last few years that if you actually do some purposeful activity in these concentrated bouts, then we're going to get to actually better health benefits. And unfortunately, now the number drops to about 5%. So what does that mean? About 95% of Canadians don't get enough. Canadians are a bunch of liars as well, by the way, because if you ask a bunch of Canadians, they'll say, yes, I'm active, no problems here. But in fact, for most of us, there is some opportunity to tweak this and to do a little bit more and get some health in that way. And it's interesting, organizations like the American Heart Association, you know, for decades, they have been a strong voice and advocate for heart health internationally. They focused on, you know, good emergency care to get people to hospital, to get their heart attacks treated, you know, good surgical interventions, these sorts of great procedural things. But for the first time, just recently, they decided to put out a statement that says fitness is actually a very important thing, and fitness is something that needs to be assessed in routine clinical practice every time, a vital sign, just like anything else. If you measure heart rate, you measure blood pressure, you should measure fitness as well. And they called out a piece of evidence like this that would say, you know, on the y-axis is the age-adjusted death rate, and on the x-axis are people in the low fitness category, medium fitness category, and high fitness category. And you'll see that there's a striking difference in death rate, as much as 3 to 4-fold. The fitter you are, the less chance you're going to die. Really, really important. Okay, so we can get out and move. We got an action plan, learn, plan, do, reflect, get your exercise groove going on. And is that enough? Well, maybe you've already got that mastered, because now we're into week 3. Well, think about starting a resistance training program as well. And we know that the physical activity guidelines would say that we should not only walk, but we should also lift. And why is that? Well, here's a nice little tidbit for us, for those of us who are past the age of 40. Well, muscle mass is going down, baby, and it's going down 1% per year. Eventually, if we live long enough, we have nothing left, which is very, very scary. So start that resistance training program. Do it twice a week. You know, do the weights, do a band, lift a soup can, lift a water bottle, whatever it is. Do body weight exercises. Whatever it is, it's going to be good, because just testing, strengthening, stressing those muscles a little bit is a way of actually protecting against this loss with time. And my colleague Susan Marzolini, who's a brilliant exercise scientist, led one of our studies in terms of looking at literature about what if you did both things, like lifting weights and walking around versus just walking around. Well, the combined training leads to better strength, no surprise. But it also leads to better fitness. Remember, fitness equals survival. It allows us to work better, not only at work, but in our daily lives. And we can actually control the amount of fat in our body, in our limbs, and in our trunk. Good things to do. That's why we should do combined training. Ready to keep going? So it's not enough just to move more, but maybe we should also sit a little bit less. And you know, one of our other wonderful colleagues, David Alter, did a session about sedentary behavior in this series. If you haven't seen it, go back, watch it. It's tremendous. the couple of quick highlights here. Here's a nice little graphic, or not so nice graphic. Sitting is not a nice thing. And indeed, research around the world, and some of our research as well, which suggests that even if you exercise regularly, if you sit a lot, so if you are binging Netflix or Apple TV or whatever it is, it's compelling, it grabs you, but it's also very, very dangerous for you, right? That the more you sit, the more your risk of dying goes up, even if you're a regular exerciser. So on the left-hand part of this slide, you'll see people who actually do a lot of physical activity per week, like an hour a day, 7 days per week. And in the red, that little red square says, if they only watch less than 1 hour of television per week, then they have the very lowest risk of heart disease, of death from heart disease. But on the gray bar, if you actually run around for an hour, then you sit for 7 hours at your computer, then your risk of dying actually doubles, even if you're a regular exerciser. On the right-hand part of this slide are people that never exercise. Of course, their baseline risk is much higher, and they also will double their risk if you watch a lot of television. So, prolonged sitting doubles cardiovascular death, even in regular exercisers. Leads me to this kind of thought. What is the most dangerous place in the house? It is this. And paradoxically, like if you're going to binge some kind of streaming service today, you would just log in and the show would pop up, right? And there would be no warnings on that at all. But if you were going to pop in a yoga video that you were going to do at home, the first thing that comes up on that screen is, be careful. Please consult with your doctor before doing this very dangerous activity, cow downward dog, or what is the thing where you do the tree or something like that. You know, those things inherently are seen to be risky. But we accept this as the risk, right? We accept sitting on the couch as something that we do every single day. I would argue that we should have caution signs about on the couch that would say, caution, please consult with your medical professional prior to use, because this is what's going to kill you, not the yoga video. Thank you very much. The power of food. Food is really, really important. We have 3 modules in the THRiVE series that talk about choosing healthy foods, developing a healthy relationship food, and then specifically talking about eating the Mediterranean way as one specific pathway, because that might be actually one of the proven ways of getting to health, and we'll talk a little bit about more in a second. I think in this health series that we should probably do a specific targeted session on nutrition, so I'm not going to go into a lot of detail about that, but there are some very important things that we can think about with food. Choosing it, how we interact with it, and then specific patterns. On the pattern kind of idea, that we do have a recent guidance from Health Canada around the Canada Food Guide that's revamped. And what we actually really like about the new Canada Food Guide is this kind of plate model that's been revamped. And just visually, when you look at this, you'll see most of the real estate on the plate goes to things that are green or red or something else that's really colorful that are plant-based. That's the exciting part. Eat more fruits and veggies. If you got nothing else, do that. Grains occupy a quarter, so having a healthy grain choice, whole grain, is really, really good. And then we have options on the protein side, whether it's meat or dairy, fish, an egg, a plant-based protein, that's our other quarter. So you got lots of options here, but it starts with that fruit and veggie and fiber and making these really fun, healthy choices there. So think about the Canada Food Guide. And the pattern of eating that we like to talk about is Mediterranean in nature. Why? Here's, I think, only one of the couple of medical slides that I'll show you, but just to say that there is a strong base for this, right? So if you were a Spaniard and you had the option of eating maybe more of a Western style of diet versus eating more a Mediterranean style of diet where you're going to have more fruits and veggies and fiber and nuts and seeds and a liter of olive oil that would be delivered to your house every 2 weeks, that if you have that pattern, the difference in your risk of developing a heart problem is about 30% if you actually follow the Mediterranean pattern of eating. So there's power in food, and if you're going to choose a pattern of eating, then it would be this. Eat like a Mediterranean, choose the healthy fats, fruits and veggies, etc. And if you want to know how you're doing, one more reason to visit the Healthy University or the Cardiac College is we actually have a scoring tool for you where you can enter in your own dietary pattern and we'll tell you how Mediterranean you are. How Italian are you? And the more Italian you are, the better off you're going to be. Medications. So exercise, nutrition are really important. And because many of us are actually living with the condition, high blood pressure, diabetes, cholesterol, don't be defeated. You're going to live well with that condition and embrace those lifestyle kinds of things. If you're on a medication, that's okay. But just be thoughtful about the medications. And what we know from kind of surveys of populations is our relationship with medicines is a real love-hate, or maybe more hate than love, actually. That it's very common for people not to take the pills that they are prescribed. For conditions like diabetes or hypertension, the medicines can actually play a very, very important role. If we're not being adherent with these medications, it actually leads to bad things. And the US, recent surveys have suggested that about 100,000 deaths per year can be attributed to not taking medicines. In Canada, that number might be like 10,000 per year. So preventable deaths, $100 billion in preventable medical costs in the US per year, $10 billion here. So if you're on a medicine, think about it. We know that in the healthcare system, we can do a better job about discussing what these medicines are, the rationale, but think about them, and think about them as part of your health package, not something to be avoided. Mental health, extremely important, and we need to pay attention to this. We're delighted that in the Health Innovation Series that we did actually do a great session around mental health. If you haven't seen it, go back to the archive and watch that one. It's terrific. In our world of cardiovascular disease, here's a couple of quick tidbits. Depression doubles your risk of heart disease. Heart disease doubles your risk of depression. They go together. It's common, and it deserves recognition and appropriate management. You know, there's probably some biologic connection between the heart and the brain. Blood vessels obviously are shared between the two. Inflammation and effects of these different conditions affect both our heart and our mind. So let's think about those. If we don't recognize it, we actually create some more challenges for us. So very important to recognize that. Sleep as a central role, and this is another great topic in the Innovation Series. If we haven't done it yet, we really should, and there's great sleep experts within the program. I know we have done other education around sleep. And if you don't sleep well, though, this has a whole terrible cascade. Develops more heart disease, elevates blood pressure, makes all of the good health things that we're trying to do that much more difficult. And the sciencey bits about this is that sleep, if you don't sleep well, you're charged up all the time. The sugars go up, blood pressure goes up, inflammation goes up. It makes it really, really difficult to be healthy unless you do sleep well. Leading to strengthen your social relationships, home stretch here. This is something that's really, really important. I'm delighted that we have people in the room and online, but increasingly we're kind of connected virtually. Let's not forget that being connected in person is actually critically important for us to do well as humans. And strengthening social relationships is one of the really great things that we can do. Emma Sapala, who's a real guru in this area of social connectedness, has a lot of great information about this. And again, the sciencey bits about this, the more connected we are, in fact, we'll live longer. We'll have better mental health. We have better self-esteem for ourselves, but we'll also be able to be more empathetic towards others. Emotional health. So there's lots of great things that happen when we are connected. And in that whole theory of how we actually excel as humans, if we believe in the Oprah-isms of being your best self, which is a tremendous kind of concept, one of our basic human needs is to be connected to one another. If we got all this right, wow, that was an exciting journey, wasn't it? That was 11 weeks of time. Now we're into week 12. If I've mastered all of these skills, if I've done all my action plans, done all the learning, planning, doing, reflecting, and I've become a master of all of this, well, this should be easy when I get to week 12. I can choose health every day. In fact, this is the recipe for best self. Maybe even more than buying Apple TV, by the way. So choosing health every day would be a great thing that we can actually achieve in the end. So we invite you to thrive. We invite you to come to Healthy University. Pick your adventure, start with action planning, choose your adventure through this, and do really, really well. If you need some other resources, we have them for you. Come to Healthy University, learn about the heart, learn about diabetes. A new platform that will go up very, very shortly is called Acceleration, around prevention of chronic diseases. We're here for you, and we're delighted to be able to share these things. Thank you very much for joining in today's webinar. We're on this slide that invites you to please ask questions and send them along to trf@uhn.ca. Thank you very much. I'll leave it up there. Great. Cindy's coming back.
Coming back. You know what? We're going to sit.
Okay.
I know we should be standing, but I think we're going to sit. Yeah? I
Cool.
think it's the height differential thing.
Yeah. So that's spooky. If I go up on
I know.
Okay,
I have
here we
my
go.
heels on
All
today.
right, great.
Okay, so we have a lot of questions, but you know what? I was thinking that was a great presentation.
Thanks.
Thank you. I've heard you speak many times. We've had you come out and speak with so many groups and online and live, and you're awesome. You really are. You know, I was thinking back to the first meeting I did when I arrived at Toronto Rehab, which is now part of the University Health Network, a number of years ago. And the first meeting was with you. And we were at a conference downtown, and you were the first clinician scientist director. And at that point in time, we were talking very early days about doing something that was well beyond the confines and walls of our hospitals and really pushing out to the public. And so that was about 7 years ago. And just reflecting back today, it's like come so far. And really it's you and your team within the cardiac rehab program and the Monk Center, Peter Monk Center at the General and Western as well. So congratulations on that. You know, listening today to your 12 steps and the THRiVE program, I have a hard time saying that, the THRiVE program, I was thinking, you know, it's really the psychology of kind of healthcare, or the psychology of getting yourself better, whatever better looks like. Can you talk a little bit about the psychology of making those first few steps?
Yeah. So any kind of change, I think, is very difficult, right? And being thoughtful about it and actually having a plan is really critically important for success. Too often we think, I'm just going to do something. You know, I'm going to get well, I'm going to get better, or I'm going to run. Whatever those things might be, that, you know, the goal without the plan is really just not going to go very far. And smarter people have said that sort of thing. And I think we're learning this in healthcare. Too often we've been in this model where, certainly as physicians, previously all we learned was if we just tell people to do stuff, then it'll happen. And we're actually surprised sometimes when the right things don't happen, or serious things go wrong, in fact. So we're learning much more about behavior change and the science behind behavior change. And I have the pleasure of working with really smart people that are in psychology and in the area of behavior. So learning about what actually makes people tick, getting to the root of that, and then designing smart programs that help them on the journey. I think this is really critical in the way that we can actually advance healthcare in a meaningful way in people's homes. And to your point that it's interesting how the hospital has evolved. You know, our acute care hospital now has a mission, not of necessarily, you know, doing the most kind of this procedure or having the reputation of this kind of specialty care, but in fact the hospital's mission is around creating a healthier world. And to get there, that's where we need to understand how people actually tick and work, and how we can play a much bigger role in that journey.
You know, on that note, thank you. On that note, you know, I joke sometimes, and it's not really funny, but you know, I chuckle to myself. You know, we want to keep people healthy. We want them to live the most beautiful lives, and we want to keep them out of hospital. So I joke in that we want to put ourselves out of business. We want all of you to be with your families, with your friends, enjoying every day, you know, being productive at work, really, you know, loving your life. And so I think that's what you're all about, right? Whether it's someone who's had a cardiac or incident and trying to get them back on track, or diabetes, or a whole host of chronic illnesses, you can make a change. And humans are really resilient, right? We have the ability to heal ourselves to a certain extent. Can you talk a little bit, and we've had a number of questions, you have some, I have some as well. Can you talk a little bit about group dynamic? About, yes, you can do it on your own, and there are apps, and we have great tools for people, but a little bit about, you know, working in a group, kind of setting goals, whether it's your family We have a lot of workplaces online with us today about getting together and doing something great as a motivator.
Yeah, absolutely. So I think we can look at this in a few different ways. We talked about social connectedness and why that's so important as kind of a basic human need. So doing things together with others, sharing stories, embracing the peer support, I think is really, really critical. We see this every day in our cardiac programs where people rely on each other as much as they do us, which is awesome. And some great colleagues have actually championed the notion of peer support types of programs. In workplaces, the notion of getting into challenges. So exploiting or capitalizing a bit on that competitive spirit in a friendly way, I think can be helpful depending on the environment, right? So sometimes we can go a little bit too far in that way, and it's not for everybody. So sometimes I'm a little bit more on the cooperative team as opposed to the competitive team. An example would be, is it group A or group B that's going to win the prize? Or the pizza lunch, is that a prize? I don't know.
Shouldn't be pizza though, right?
Or is it by doing more physical activity one group than the other? Or the kind of the group thing that I like is together, let's walk across Canada. Or together, let's walk to the moon and back, depending on the size of our organization. So we can actually leverage competitive and cooperation in groups. But I think it's also important to create the menu of offerings, right? Because people are very different. And some thrive in groups and love that kind of social environment. But it's also nice to create some opportunities for people that want to do things on their own. And the great thing about that we're very proud of in, say, our cardiac program is that we have those offerings, that people can come on site and work with others in a group. They can work one-on-one with a coach at home, or they can do things just online. If they've got that great self-efficacy, if they've got that great kind of construct, if they have everything that they need, but just need that little bit of nudge and framework, then that works. So most people will like their groups, some may not, but for all of them, we can help them on their journey.
Absolutely, different strokes for different folks, and certain things resonate better for some than others. Just very briefly, we did a fitness challenge at our office recently. It lasted 2 months, and it was a friendly competition, and the winner, quote unquote, the winner is actually sitting in this studio with us right now. Elevated his fitness level, lost 12 pounds, looks like a different person, not just physically, like the color, everything looks different about this individual. And so it does work. And again, not for everyone, but for the right group, it can be really, really powerful.
I'm assuming pizza lunch was not the prize as well.
No, it's not the prize.
No.
THRiVE, the THRiVE program, it feels like it's almost like your coach and your cheerleader. Am I right about that? So it gives you kind of the framework, but it also kind of encourages you to stick with it.
Yeah, I think that's a really nice way of thinking about that. That certainly it's your coach, and that it gives you the right kinds of steps in a logical, thoughtful, evidence-based kind of framework. You do have this sense of satisfaction, so hence the cheering. But I think also through the course of the program, what we're trying to build is a lot of kind of self-reflection, self-determination, and a lot of self-efficacy. So by the end of this, I hope that you're your own cheerleader. That's the real goal of all of this stuff, is that you learn how to run this stuff on your own, which is really great. So I love that comment, a coach and a cheerleader all in one.
Yeah.
Terrific.
And you know what, when you make those shifts, those little shifts, it's not like if it's nutrition, it's not like going on a diet. We just want you to think about your diet, not go on a diet, and make those little shifts. And I've heard you say this before, it's like once you make those little shifts, you start to feel a little bit better, and you add a little bit of exercise, and maybe you don't have that second glass of wine on a Saturday night, and those other things, and it just kind of builds on itself, which is really powerful. And so nice. There is the possibility to have these profound changes. I think you have a question there.
So the one question that came in online, what are some best practices to help healthy individuals lower the probability of getting type 2 diabetes? And this came from our colleagues at Scotia. So great question, thank you. So one piece of evidence that I can point to around diabetes prevention is actually a study called the Diabetes Prevention Program, oddly enough. And it wouldn't be a surprise to you that in an evidence-based format, that one of the best ways of lowering risk of diabetes, now this happened to be a kind of sedentary, not eating well kind of cohort of middle-aged adults, when they learned actually how to eat more thoughtfully, mindfully, and get active on a regular basis, just like we've talked about with THRiVE. So 5 days of exercise, aerobic, 2 days resistance, being thoughtful about the food program, and managing the mental stresses in life. The risk of developing diabetes through this kind of lifestyle type of program went down by about 66% over the course of 5 years. Mm-hmm. And by the way, that outperformed taking a medication to prevent diabetes by twofold. So this is actually a great way. THRiVE would be one of our local kind of answers on how to prevent diabetes.
It's really grabbing hold of your own healthcare, right? Like your own well-being, and the tools that you've developed really are really a godsend, I think, for many people. So I didn't mention this. Through your program, like tens of thousands of people have gone through your cardiac rehab program.
Yes, absolutely. So as Cindy knows, and she appreciate her setting us up in this way, that the cardiac program just celebrated its 50th year.
Amazing.
In that period of time, it's a bit of a guesstimate, but I'm pretty sure it's accurate that we've probably served 70,000 people in the program at that period of time. So it's exciting that we've been able to do that scale of work, and we're excited through assets like THRiVE, through building the Healthy University, that we can touch the lives of tens of thousands of other people. The traffic on the web platform is growing exponentially, so it's very exciting that we can now provide resources and kind of opportunities for people way beyond the people that have come to us. To your point, Cindy, that our footprint, our desire is to reach much beyond our walls.
And you know, when you say 70,000, I mean, it's an approximate. Really, when someone gets sick, when someone's not well and say they've had to go into hospital, it's not just the individual, right? It's that whole network around them. So it's the partner, the spouse, the children, the colleagues, the friends, the neighbors. So like when you start doing the multiplier, you say 70,000 people directly through our cardiac rehab program, but the multiplier effect in terms of impact is dramatic. So, okay, I have a question from Linda. Dr. O, how do you see the roles of naturopathic doctors and chiropractors?
Great question, thanks, Linda. So I think we can be much more collaborative with all kind of providers in the health system. We all have a role to play. Naturopaths, chiropractors, massage therapists, physiotherapists, dietitians. Everyone has a role to play in this kind of healthcare journey. Given, for instance, if we think about physical activity or nutrition, the opportunity and the need really is pretty much everybody in the population. You know, there's no way that the traditional Western medicine system can actually cope in this way. So finding the strengths of all of our disciplines, finding the great expertise that lies in naturopaths, in chiropractors, in physiotherapy, dietitians, that if we bring all of those resources to the table around the individual needs and preferences and desires of any individual, I think that's the way we're actually going to transform health.
Okay, great. So the THRiVE program is about your own goal setting and choosing what are the things that are most important to you. But I do have a question here that someone's asked. If someone has a lot of changes to make, which one should they start with first? Can you make a recommendation?
That's a great question. So which one do I think they should choose? And just by the way the question is asked, you know, the answer is kind of predictable. It's not for me to choose, right? And that's why if we think of Module 1 in THRiVE, it's about deciding on what's most important to you, of a menu of things that we would like to change. And all of us probably have a list of things that we would like to change. Ask that question about what is most important to you, not what's most important to me. And that's why, you know, in a medical appointment where I might be looking at someone who has high blood pressure and diabetes and high cholesterol, who smokes and who's inactive and doesn't eat well, well, there's 6 things that we can work on. My traditional medical model would have been either I'm going to tell you what to do on one or more of these things, or I'm going to try to make you change all of them. And then it shouldn't be surprising where we've run into hiccups. Instead, if we flip that on its head and ask the question, what's most important to you, we might actually lead to success. And again, that classic model is somebody who might smoke, which is we understand is maybe not the best thing for our health. My colleagues would say, pick smoking, because we know that's probably the most kind of threatening to health. But for someone who's not ready to quit smoking, it's actually harmful, potentially from a behavioral sense, for me to hammer at people to say, you gotta stop smoking today, it's terrible for you, don't you know that? Don't you know it's bad for your family? Don't you know your arteries are hardening right now? Don't you know it's bad for your lungs, et cetera, et cetera. If someone isn't aware, or if someone isn't ready and feeling that's important, that's a lost conversation. It's also a lost opportunity to work on something that somebody is ready to do. Because of the 6 or 12 things, if we can work on one thing, that's exciting. In physical activity, we always say, what's the most important step in physical activity? The first step. If it's just one step, that's one more step towards health, and I love that.
Unless you're trying to complete a half marathon, then it's like the 20,000.
Then it's it's the next step. One step and then the next step.
So yeah, I know you're an awesome runner, and we cheer you on every time you go on and do one of those half marathons. Paul, there are a lot of people, like I mentioned earlier, that have joined in from their workplace. So we have a lot of corporate partners and friends out there. How important is it for people confined to office spaces to build in break time during the course of their workday?
There's a loaded question there, and I can sense from whoever asked that question defending the break. I think it's a great idea. I think breaks are wonderful. Lunch hours are wonderful. On CBC this morning, they were talking about the importance of the lunch hour and actually taking some time at lunch. From medical data, we know that if you're confined in your office and you're sitting, for instance, that's actually a very hazardous setup. That it creates, for instance, difficulties in our bodies to handle the sugar loads that come in. And some colleagues in the UK did this interesting piece of research where they took office workers, allowed their usual condition of sitting for most of the day, and looked at sugar profiles. So on Monday, Tuesday, Wednesday, Thursday, Friday was a standard lunchtime meal, and watch what happens with sugars. And after the lunchtime meal, they could see sugar go up, and it stayed up for about 3 hours before it went down again. The next week, what was allowed was people to take breaks and to stand up and down, and actually some of them worked at standing desks. By the time the standard meal came down on Friday, sugar levels went down by about 40%, simply from taking the breaks and standing through the course of the afternoon. So it can have an important effect on the body. Mental health, of course, is tremendously improved by us just detaching a little bit from work for just a minute, going out, taking a walk, getting some air, doing those really good things. So there's lots that we can do in the engineering of our office places to actually improve health.
That's great. So I have another question. I know you do too, but I'm just going to go for it. Is there an opportunity to meet with the professionals at Toronto Rehab regarding the THRiVE program?
The answer is yes, absolutely. We enjoy having conversations with interested parties, whether you're at work, whether you're at an insurer, whether you're at a bank, whether you're at home. Please do give us a shout. I guess if you want to send your contact info through trf@uhn.ca, absolutely. The foundation will certainly pass your contact info forward to us, and one of our team members, the most appropriate team member, will get in touch with you, and we'll see what we can set up.
Awesome.
How's that as an answer?
Perfect.
Super. How are we doing time-wise, Ivana? We're still a little bit? 5 more minutes. Okay, so here's one. How did THRiVE come about? How did you come up with a 12-week timeline? Lovely question. So THRiVE, of course, one of the things we pride ourselves on in our program, and indeed many aspects of medicine, is how do we create cool acronyms out of very complicated, impossible kinds of topics. So targeted health risk interventions and education does not roll off the tongue very well, but it captures the essence of what we'd like to achieve. THRiVE came about as, I think, an opportunity that we saw in the rehabilitation prevention programs that we offer from a medical perspective every day. And it's that kind of daunting thing of, you had a heart attack, here's everything that you need to know and do. Just do it. We actually have guidebooks, like a course material for people, and said, okay, here's 250 pages of a book. Read it, do it, love it, embrace it, and you'll be healthy. we know, to our point about how people think and behave and respond, that you might want a different journey. So THRiVE was a way of us taking that complex information and packaging it into a thoughtful framework. So let's take all of that and break it down in 12 weeks. Good. We know the main modules that are probably important for health: goal setting, action planning, nutrition, physical activity, medications, mental health, taking control. That all makes really good science and is behaviorally based, so that's great. And then with each module, we thought, what's a creative way that we can present this? Let's make it multimedia, videos, web, text for people that like to read and interact in different ways. Let's make it interactive so that there's actually things that you have to do, not just read and sit, but actually do something. So that was the whole kind of construct. And then we had great developers on this, and shout out to Crystal Altman, who's an exercise professional, also an educator, has a master's in this area, and Nicole Sanderson, who worked hard on developing the whole program. So having really creative, thoughtful people that can put this together, that makes the real difference. And then interacting with a whole great multi-professional team and patient input, that's how we can actually make a dynamite product and have the right kind of media team come up with it. 12 weeks, why 12 weeks? Because I think that we need a minimal dose to actually change behavior. And from what we've seen working with clients over 50 years, is that probably 12 weeks gets us to the point where people can start behaving on their own. If it's shorter than that, then it's kind of ideas that might just kind of go in one side, go out the other. But if we actually do this and do it over and over again, the stuff starts to stick. So 12 weeks, get sticky, make behaviors actually kind of last over the long term.
Great.
Cool.
You really are like a coach and a cheerleader, aren't you?
Yeah.
You know, we have this real desire and belief that we can help people stay out of hospital. We can help people through, you know, your expertise and your colleagues right across the healthcare system. That people deserve to be healthy, right? But when I say deserve, they need to grab hold of it, and they need to take charge of their own lives, their health and well-being. Again, whether it's, you know, alcohol consumption or sleep or relationships, diet, nutrition, on and on and on. So I think we're coming to the end of our session today. You know, for those people online and here in the studio, keep asking questions. We're not done in that we're going to respond back to everyone who continues to submit questions and inquiries, and you know, we'll send out some linkages and information about THRiVE and Health University, which is, and its colleges, which is a neat model that you've developed. So I just really want to thank you, Dr. O, again, for spending your time with us today, for sharing your knowledge, and for really getting behind kind of the whole notion of health, and again, allowing people to live the most beautiful lives. So we're very grateful to you, and you know, thank you to everyone that signed on with us today. Again, keep asking your questions. We will respond to them, either Paul or my colleagues or those in cardiac rehab. We continue to do these sessions. We get a lot of great feedback. I believe we're going to be doing a post-session survey. So if you have any feedback for us, comments, insight, or if you have specific topics for future sessions that you'd like us to do, that would be great as well. You mentioned in your presentation that we have a repository, the archive. We encourage you to go check out our YouTube channel. That's Toronto Rehab Foundation's YouTube channel. We encourage you to follow us on social media, whether it's Facebook, Instagram, LinkedIn, and the other platforms. Twitter. I think we're Twitter. Thank you. There's so many of them these days. It's hard to keep up. But again, thank you to my colleagues for putting this session together, Henry, Giovanna, Kevin, Arlene, and others. Really appreciate everyone's effort. So it's a beautiful sunny day in Toronto. I hope it's beautiful and sunny wherever you are. Go out there, enjoy the day, go for a walk. See you soon.
Thanks,
Thank
guys.
you.